Amipara, on behalf of Organizing Committee ICHVHE 2025, I warmly welcome all dignitaries, moderator, UHE point of view, panelists, and all other delegates. Since 3 days, we are hearing about the human values and holistic human health. During keynote address also we have heard, and since 2 days we are discussing about need, then we will discuss about vision on a holistic human health. Now, and we are quite enriched about the human health and its holistic approach. Today, we have experts, and let us have an expert views on implementation part, which is very important as far as health is concerned. So we will discuss, we will hear about the implementation from the experts. It is my privilege to introduce today's moderator and UHC point of view. Today's moderator is Mr. Manoj Jalani. He is a director, Health System Development, WHO, Regional Officer, Southeast Asia, New Delhi. Sir has been member of IAS, Indian Administrative Service, has served the Ministry of Health and Family Welfare, Government of India. He Joint Secretary, Policy, and later Mission Director, NHM, and Additional Secretary and Special Secretary, Government of India. He did his MBA from UK and IIT Kanpur. He has served as he has several awards to his credit, including UNIATF award for the NCD challenges. With this brief introduction, I warmly welcome Mr. Jalani. And we have with us our UHF point of view, Dr. Sharmila Asthana. Madam did her MBBS from Mahatma Gandhi Memorial College, Indore, Medical College, Indore. Pediatrics from Regional Children Hospital, USA. Madam has worked as the assistant professor of pediatrics, St. Christopher Hospital for Children, USA. Madam served as a senior consultant pediatrics with the Apollo Hospital for about 17 years. Also worked with the lipid diagnostic. Madam has keen interest in ambulatory pediatrics, educating children for minimum use of medication. Since 2018, she left the practice and devoting full time to UHV and pursuing approach to health. Madam is resource person for universal human value and workshop of holistic human health. She is co-authored book on holistic human health program. She lives in Hyderabad with her family. Her likings are reading and writing books. With this brief introduction, once again, I warmly welcome Mr. Jalani and Dr. Sharmila. Now, I will hand over the stage to Mr. Jalani. Over to you, sir.
Thank you so much, Dr. Amipara. Thank you for your kind introduction. It's indeed my privilege to welcome everyone and moderate this session. Welcome to implementation of value-driven holistic human health for youth. And I'm honored to moderate the session and delighted to introduce a very, very distinguished panel. So we have with us, I'll just put in brief profile of panelists, not really going in great detail. So we have Dr. P. Kala. She's professor and head of pharmacology, PSP Medical College, Hospital and Research Institute, Chennai. And she has a rich 25 plus years of clinical teaching and research experience in the medical field with more than 20 publications to her credit. And she has a keen interest in holistic health education. Welcome, Dr. Kala. We
Morning,
have
sir.
Dr. Meenakshi Manerikar. She is bachelor's in Ayurveda and a postgraduate in Ras Shastra and Bahija Kalpana Ayurvedic Pharmacy, and again with more than 20 years of professional experience in clinical research and academic areas. She's now pursuing a PhD from Datta Meghe Institute of Higher Education and Research, Wardha, Maharashtra. Welcome, Dr. Meenakshi. Then we have Professor V. Satyanarayan, Associate Dean, Student Affairs, and Professor of Pharmacology, SRM Medical College Hospital and Research Center. He has 31 years of teaching experience, 25 years of clinical, and 15 years of research experience with several awards and publications to his credit. Again, keen interest in human values and holistic health education. I'm not sure whether Dr.
Thank you, sir.
Sudhir.
I'm here, sir, with Sharmila ma'am.
No, no, Dr. Satyanarayan is there, but Dr.
Yeah.
Sudipta Ghoshal
Okay.
is he also here on the
Yes, yes,
panel?
yes. Good morning, sir.
Good morning, Dr. Sudipta. Okay, Dr. Sudipta Ghoshal is a clinical practicing homeopath, also has nearly 25 plus years of experience in hospital administration, medical affairs, and healthcare services. Head of Department of Hospital Management in Palmer Medical College, Durgapur. Welcome, Dr. Sudipta.
Thank you.
And then we have Dr. Manoj Kumar Sharma. I'm not sure I can see. Oh,
I think he has not joined us yet.
okay, thank you. And Dr. Panda, Dr. Swarup Kumar Panda, is he? Just wanted
Dr.
to.
Panda also, I don't see him
Okay,
having joined
okay.
yet.
Am I missing anyone? Or have I captured all the panelists? My apologies. I'm seeing some on the screen, but
Yeah, I
okay.
think it's for now.
Yeah, I have captured, I believe, everyone here. Okay, great. So welcome once again. And now, in terms of, I'll just briefly lay down the sequence of proceedings. So first of all, I'll be requesting Dr. Sharmila to put forward the implementation of the vision for empowering youth to take care of their health holistically. Then we will have 2-3 rounds of discussion, depending on the time, where I'll be putting forward a question to each of the panelists and request your views on the topic. Broadly, each panelist will have about 3 minutes to respond, and each of the panelists will see a stopwatch appear on your screen as you begin to speak. We request you to be mindful of the time so that we can cover as much ground as possible. Again, we'll request all the panelists to keep their videos on throughout so that you're visible to all the delegates in the audience. And also request the delegates in the audience to participate. We will see one or more polls appear on your screens, and we request you to participate in those polls so that we can have your views too. So now I'll request Dr. Sharmila ji to kindly put forward the implementation of vision for empowering youth to take care of their health holistically. So over to you, Dr. Sharmila ji.
Thank you so much, Jalani ji. It is such a pleasure to have you join us in this effort. So, for the past 2 days, we have been dwelling on first on day one, the need for holistic health as observed by a SWOT analysis of the health of the youth and of the health system today. And then yesterday, we talked of the vision that we have for holistic human health. And now, today, we'll be moving on to implementing this vision for health. So, as we spoke yesterday, we want to move from what we see on the left side, a body centric approach, largely where the human being is considered to be the body and the self is not really considered in the picture much, to move from this to a holistic approach. Because when we consider the human being just as the body, for the health of the body, we a lot of times are dependent largely on tests for detection of disease. And we end up really being disease focused, medicating the body sometimes lifelong, to manage the disease. And a lot of times the cure is not so clearly visible, and clarity on the root cause is sometimes missing. So we would like to shift to a proposed holistic approach where the human being can be seen as a coexistence of self and body, where the health of the self would be the number one priority. Once the health of the self is taken care of, then the self, with the feeling of self regulation, will take responsibility for the health of the body. And you can see on the screen a proposed program of health that could be used for keeping the body healthy. So, for staying healthy, the intake, the daily routine or lifestyle, labor and exercise, postures for regulating internal and external body organs, and regulated breathing could be taken care of. And then, if and when the body goes into disharmony, then we can use the medication and treatment part. So, with a healthy self, the body health would thus be taken care of, and the healthy self will also have a focus on the health of the environment, that is the family, society, and nature. So we discussed some of these things yesterday. Today we are going to discuss the implementation part. So here this is just showing the same thing on the proposed holistic perspective on health, where number one priority is the mental health or health of the self, so that with that we understand the human being, we understand the self, and we understand the harmony in the self, harmony leading to happiness or a healthy self. With that, second priority is the healthy body, where one can understand the body and what leads to harmony in the body. And third priority would be a healthy environment, where the healthy self also understands the environment and what leads to harmony in the family, the society, and in nature. So understanding the self, its relationship with and role as a human being in the harmony of the body, the family, society, nature, and existence, the individual lives according to this, starting with taking responsibility for the body and ultimately having this right feeling within, the values driving the feeling of love and compassion for all. So the way forward in implementing this holistic vision of health, of course, one of the key areas would be more research on the self or the consciousness. The more we know about it, the more we understand the self, the more we can have clarity on the whole picture. For that, besides the research, there are also sensitizing workshops on universal human values and holistic human health in academia, in education, for faculty and students. This, to a large extent, is already in place. Many of these workshops are already happening. And in fact, just last month, we had a holistic human health workshop for the faculty here in SRM Medical College and Research Center in Chennai. Similarly, we can also have UHV and holistic human health courses in academia, which is for students. These could be as an add-on to what is already being covered in their syllabi. This also, to a large extent, is already in place and can be enhanced. Again, in line with that, if we can go back to the last slide, one thing that is very important to consider is holistic centers of well-being, which are in the pipeline. This is being planned for in the coming future, where we can have integrated approach to treatment, which would cover various streams of medicine. So the centers of well-being would have not only the education part, but also health maintenance and treatment being covered by various integrated streams of medicine. Next slide. So when we look at implementation in health education, one major part is the preparation of the faculty. So many FDPs on universal human values are being conducted, FDPs as in faculty development programs, so that our teachers may have a holistic, humane world vision. So something that has been done and is in place are introductory UHV FDPs on universal human values, which could be 3 days face-to-face or 5 days online. And then we have the UHV2 second level FDP on human values, 5 days face-to-face or 6 days online. This is already in place. We also have faculty development programs on holistic human health, where the focus is on the responsibility and competence of every individual to stay healthy and to promote health in the environment. For this, the introductory or holistic human health 1 FDP is 5 days online or face-to-face. The things that are considered in this, one is the holistic understanding, so that understanding is not just based on a body-centric approach, but rather a self and body-centric approach. We also talk about the universal health principles in these workshops, which are based on the reality, and the recommendations regarding holistic health, which are based on these universal principles. Also included in this are self-observation and self-exploration exercises, where understanding of the self and the body takes place by direct observation. And to track all of this, to track one's progress in health, we make the use of a health tracker, which has been found to be very useful, and people have appreciated that. Next slide. When it comes to implementation in education as courses for students, many of these courses, again, are being run as first semester or 1 semester 3 credit courses. Again, these are courses which are being run as separate courses which are added on to the main syllabi that are already there in any institution. So UHV 1, as an introduction to universal human values, is being run in many institutions, universities in India as part of the student induction program in the first 2 weeks when the new students enter the institution. The UHV2, the foundation course in human values and professional ethics, understanding harmony and ethical human conduct. This is conducted later during the tenure of the student, perhaps in the 2nd or the 3rd year. And under the banner of UHV, this foundation course in holistic human health, its philosophy and practice. This is also a course that is available for students to be run as an add-on to the main syllabus. And eventually the purpose of all of this is to have holistic value-based education, so that in every stream, value-based education is the one that is prominent. And then based on that, the skills that are required. Also, we want more research on the self in terms of not only research as being put, but also in evidence-based medicine. And ultimately, like I was mentioning, implementing in health maintenance, counseling and wellness centers, which would provide an interactive, integrative approach to well-being of all, in addition to the current system of medicine. So in addition to our hospitals and the systems that are already in place, we could also have holistic centers of well-being where health education would be a part of it, and practices on how to stay healthy would be included. There would be counseling services and integrated healthcare for those requiring treatment. Next slide. For all of this, there is a wealth of resources and resource material that are available to all. To begin with, there are many, as we mentioned, these workshops and support resources and support for implementing these workshops in several other institutions. Whoever has interest and would like to pursue, there is a lot of support for this. There are resource persons, volunteers, UHV volunteers, health work volunteers who are can help in training the trainers. And for this, all resource material is freely available to all. The Holistic Human Health book, a foundation course on holistic human health, its philosophy and practice, is an e-book which is freely downloadable by all through the UHV website, that is uhv.org.in. This book is also available for sale on the website, but it can also be freely downloadable so that it can be used by all. Other books, videos, and resource material are also freely available on the website, freely downloadable by all. Audios and videos of self-explorative exercises, of observing the self and the body, and sharings of participants after having gone through the self-explorative exercises, the impact that they have had on their mental and physical health. This is also available in audios and videos that can be heard. This is coming from the morning session, which we have been doing for the past 5 years without a break of a single day, every morning from 5:30 to 7:30, in which these exercises are conducted on an online basis with participants joining from all over India and abroad. And it has been found very useful from the sharings of the participants and has had huge impact on mental and physical health of many of the participants. Also, all other support is available through regional coordinators for UHV Pan India and UHV nodal centers in various institutions Pan India. So this was from my side. I will now hand over again to Jalani ji for taking the panel discussion forward. Back to you, Jalani ji.
Thank you, Dr. Sharmila ji, and really very impressive presentation in terms of the how part of it, in terms of operationalizing the vision. So my apologies, I was not there for the first 2 days and have not really had the benefit of the discussions of the first 2 days. But what I understand is that today we are discussing more in terms of the implementation of the vision. Now I'll be putting up questions to the panelists. We heard Dr. Sharmila. She has laid down not only the vision, but also how the vision could be implemented. And so we'll start with Dr. Kala. And so broadly, I mean, these are questions which will be addressed to each of the panelists here. So as a healthcare professionals, what do you see as the possibility of implementing this holistic vision of health in your institution or area of influence, So in terms of whether preparing yourselves for workshops or faculty development program or introducing courses for the students or developing holistic wellness centers. So over to you, Dr. Kala.
Yes, sir. Thank you, sir. Good morning, one and all present here. Thank you for the opportunity given to me. So it's such a nice question, sir. Nowadays we are.
You're looking horizontal. I mean, like you're lying down. I mean, yeah. Please turn around. Thank you so much.
No, it's okay. Yeah, yes, sir. Yes, sir.
Better. Yeah. Thank you.
Okay. Yes, sir. So nowadays we are in the need of having the holistic human health. It should be started from the individual, then family, then community. So working as a faculty in a college, we should encourage more kind of programs in the student side and as well as the faculty side. So for the student side, we should nowadays we have just started to have the mentor-mentee program. So in the mentor-mentee program, not only the academic side and also for the self-conscious level, that the individual problems in the body and as well as their mind. So we should have a one-on-one, one-to-one counseling kind of thing in the mentor-mentee program to improve their self and as well as the academic aspect. So in the same way, considering the faculty are also in the same line of stress pathway. So we are also having more stress in the family side, individual family side, community, and then as well as in a working aspect. So for the faculty side, definitely this kind of UHV in the FDB program for the start from the 3 days or 1 week kind of thing. So implementation in the vigorous way, definitely we can have the good kind of thing for the providing the holistic health to the patients and as well as the student side and for the individuals too. And coming to the community wise, so more kind of program in the community start like yoga or health education, health programs. So these are all the thing I think if we implement in it such a good number of programs, definitely we can implement the holistic health throughout through the community. This is my opinion, sir.
Thank you so much. Thank you so much, Professor Kala. And what I heard when Dr. Shamila was asking, I heard HHH, holistic human health. And then I was also looking as 3H for healthy self, healthy body, and healthy environment. So there are 3H there as well. Anyway, thank you so much. Can we now move on to Dr. Meenakshi, and the same question to you also? I mean, what do you see as the possibility of implementing this vision, this holistic vision for health in your institution or area of influence? So over to you, Dr. Meenakshi.
Thank you. Good morning, everyone. As I'm an Ayurvedic doctor and being an Ayurvedic student, the first thing is that in our Ayurveda, it is mentioned that we are already focusing on the mental status, like body, mind, and our consciousness. On that we are focusing already. So during our syllabus also we mentioned that if you want healthy lifestyle, then you have to focus on ahara, vihara, and sadrutta. That means you have to take the nutrition food, because according to food your mind will be like that. If you are taking the good food, healthy food, then your mind will be like uh, what we called it as a sattvic mind. And if you are taking food the you are if you are taking food like nutritious food, then some rajasic mind. And if you are taking like junk foods and all this, then tamasic mind. According to that also your behavior will be like that. So nutrition food is a first thing. Then vihara means your exercise. So how you will exercise. So according to that, we have, and sadrutta means this behavioral points, characteristics, like satyavachana or aparigraha means this materialistic what we are having today's life. The students wants all the new gadgets. So we are saying that no gadgets, just focus on your health. So like that, so we are introducing these all parts in our syllabus. And secondly, just madam said like mentor mentee. So we are also having this mentor mentee. So personalized, like each student will come to us with their problems and we are giving them solutions. Not only the syllabus wise or not only their educational part, even if they are having some personal issues also, we are addressing that personal issues. Secondly, in our institute, university level, we are taking FTPs, UHV FTPs for the faculties also, and we are introducing for student a minor degree of the UHV. So from this year, we are implementing this minor degree. So these are the points I can highlight. Thank you.
Thank you, Dr. Meenakshi. And I'm seeing the poll results also. And there is a very large number of participants who want to participate in the 3-day workshop on universal human values. And so there are those 79% are those who strongly agree, but another 21% who agree, and there's no one who disagrees or strongly disagrees. Okay, so now we move on to our third panelist, Professor Satyanarayan. Over to you, Professor Satyanarayan. Yeah.
Namaste, sir. Thank you. Good morning, everyone. And I see immense and powerful possibility to implement holistic human health program in our institution. And as an associate dean of student affairs, along with my team, I have laid the foundation for that now. So we need to build the structure. So first step was we did the faculty sensitization programs on universal human values as well as holistic human health workshops. Thanks for Sharmila ji. She gladly accepted our whenever we call her, she accepts and we come and conduct workshops here. And that is very positive support from the central team. So based on that, we introduced UHE1 course for first MBBS students as part of their foundation course. Last 3 years we are we have started this course, and couple of years back we introduced EHE2 course also for second year MBBS students as a part of their foundation course. And now recently we started the Allied Health Sciences professional course also we started, and where we implemented the EHE course there. So slowly we have started implementing UHE programs as well as health programs slowly into all the streams of medicine and health sciences. The next step will be we are planning to introduce holistic human health course as a value-added course for third year MBBS students as part of their elective subject, or maybe value-added course, so that it will be beneficial to medical students first. Then slowly we will make it happen to other students. So this is how we plan to implement holistic human health course program here. And lastly, we in future, near future, we're planning to introduce a holistic human center of well-being where all aspects of UHU as well as health can be integrated. So that center is, of course, our dream, through which we can be a model institution for whole UHU health programs. So that's our contribution from our side. And it is happening because of we started with only 5 people as resource persons, but with determination we have come to such stage where we can introduce the holistic human health program. And it will be very important for medical students because no single stream of medicine can help all diseases. Yesterday, a couple of days back, we saw that lifestyle diseases are increasing, stress is increasing among students. So they need some kind of guidance where the self can be brought in, so they can be holistic care can be provided. So not only there for students, but faculties as well as the patients and the community, the whole will be benefited by starting such center, holistic human center. So that's our current plan. Thank you, sir.
Thank you, Professor Satyanarayan. What we hear is a very strong endorsement and also you're already on the path of strong implementation of the universal human values aspects in your college. And I'm very impressed. I can only give you just some feedback about what's been happening in the World Health Organization. So last year we had a big three-day workshop and seminar in the Asia Pacific region, and this is under AAAH, and basically the focus was in terms of clinical competence, clinical skills plus compassion, and then we had in this regional committee, the health ministers from the region were focused in terms of how do we have our healthcare providers be more humane, okay, be more compassionate. So what I hear from Dr. Sharmila was two aspects of it. One is the right understanding of holistic human health. So one is this understanding. The second part was that with that, you're also hoping, and what we heard was that it should help in terms of the healthcare providers being having a feeling of compassion and love for all. Now, of course, we would be very keen from the WHO side or also from the Ministry of Health side is to document this evidence in a very, very serious manner so that we build this evidence. And as of now, while there is a big need, I mean, when we have the meeting with the regulators from this region, the regulators are very keen that the healthcare providers need to have compassion, but they are not sure in terms of what methodologies or approaches could be adopted to really make our healthcare providers not only clinically strong, but also compassionate. And the whole gamut around NCD that we heard from you and also from Dr. Shamila requires us to have the right understanding of health. So that there are two different things, but related. But one is it'll be very difficult to make a dent in terms of how the health is perceived. But in the area of how do you get the healthcare providers to become more compassionate, there's a much greater traction amongst the regulators, among the ministries of health and the WHO. So we would just request you to kindly document and create and develop and build on the evidence that we already have to make a strong case with the ministries in the region and also with the WHO. So,
Sure.
well, we'll move on. Thank you, Dr. Satnarayan, and we move on to the next panelist we have. This is Dr. Sudipta. So, Dr. Sudipta, the same question over to you.
Yes. Am I audible, sir?
Yes, Dr. Sudipta, we hear you well.
Yeah, Suprabhatam.
Suprabhatam,
Yeah,
please.
the nice meeting. So actually in our school or the colleges, the integrating of the physical, mental, the emotional, social, everything, that in one, that is it should be started from the very childhood stage. I mean the school going children, and it should be the compulsory subject for the all students in the college. In our college, for the graduate student, undergraduate student, only within the 8th semester, only the 1 semester is include the UHV. So it is our request to the all the senior, I mean the AICT or the others, the people, for the implementing this course in each semester little bit. Without the universal human value, we should people know about what is the value need of the value educations. The all educations, it doesn't mean. So the key strategies, that is the regular meditation, the peer group, the support group discussions, the repeatedly counseling, the career counseling, the value, the different people and the different situations. That is the mindfulness and the emotional skills. And from the very beginning, if we are implementing this, the Panchabhuta, the Panchakosha, the Anandamaya Kosha, that is the implementation of this knowledge. That knowledge can help a man to a human. That is our main purpose of it. The internal bliss, I mean the satisfaction level of each and every individual, and the people all should be loyal, the trustworthiness, the truthfulness, these cultures, if we can implement in our very beginning from the school going children, from the college, I think it will be the good impact after the completion of the undergraduate or postgraduate like this. And that should be the gradations of it. And everyone should realize about it. The body is just like a vehicle. And the driver is the buddhi, manas, the That is the main thing. So the control mind, the dedicated mind, the disciplined mind, the focused mind, and what is the purpose of life is only can operate through the proper intelligence. The purpose of education should lie in this. And thank you. Thank you, sir.
Thank you so much, Dr. Sudipta, and thank you for your focus on starting as early as possible. Okay, and now do we have, sorry, do we have Dr. Panda as well? I think we have, no, right? Only. So then we'll move on to the second round of questions then. Now, I mean, we heard each of you trying, I mean, we heard mentor-mentee course, we heard about Dr. Meenakshi in terms of right aha, right vihar, right conduct, etc. And then Dr. Satyanarayan implementing this universal health value for faculty and students, and they have introduced in a more advanced manner. And what we heard from Dr. Sudipta was that they're already in one semester. But just wanted to get a sense in terms of whether you faced any challenges when you started it in your institution, and also would like to know as to how you managed to overcome some of the challenges, and what steps you think your institution could take to set up the right processes in the institution to advance this work. So, whenever you want to effect some changes, there'll be some reluctance, resistance, whether how useful is it, and whether it's really effective or not. So just wanted to get a sense from you in terms of the challenges that you have faced, how you overcame, and how you would like to move forward. So we'll follow in the same order, and I'll start with Dr. Kala. So over to you,
sir.
Dr. Kala.
Yes, sir. So the challenges I and our entire team challenges faced. The first, let's start from the mentor-mentee program. So in the mentor-mentee program, keeping on a separate hour to have a mentor-mentee program is our regular timetable. So as per the NMC, we need to have almost 260 hours. So keeping on separate mentor-mentee and assembling all the students, that's a very good task for us. And from student side, nowadays the people are all very engaged with the digital world. They are living in the digital world. Everything they have in the digital world. So it's very difficult to have a digital discipline from the student aspect. So I think because of the good rapport, I don't know why the rapport is a little bit lesser with the newer Gen Z people with ourselves. Attending the mentor-mentee program is it's a toughest one we are facing. We couldn't get the 100% of attendance having that. And regarding the faculty development program, so everyone having their own what do you say goal. So the target given to each faculty. So having the faculty attending the faculty development program in spite of so many things in academic side, start from the publications and other things. So attending and implementing the faculty development program is also very much difficult for us. So we are slowly having a successful mentor-mentee program, and as well as the faculty development program. So we have started to do that, sir. So these are the challenges we are facing it nowadays. This is my point of view, sir.
Yeah, thank you so much. And just wanted to get a sense from you in terms of how do you plan to move forward on this in future? So how do you plan to address these challenges, both at the faculty as well as in the mentor-mentee?
Yeah, having more kind of counseling not only for the our conscious level, and also having such a kind of program to improve the individual society. So the importance, telling the importance of attending the program, so that we have to keep on emphasizing to each and everyone. So at one point of time, definitely it will reach to individual. So once they have the problem, definitely everyone will start to realize, so okay, this kind of program is really needed for us. So it not only for the mind and also for the physical. So disease-free world, and they will reduce the economic burden. Everything they will analyze. Once we analyze, definitely we'll attend to this.
Thank you, Professor Kala. And so over to Dr. Meenakshi, the same set of question to you as well. Over to you, Dr. Meenakshi.
Yeah. Yes, sir. So the first thing is that, as Dr. Sudipta sir said rightly, that we should start this on the school level only, because at college level, reluctance is more. Students don't want to come for this kind of courses. They don't want to learn this kind of things, that mind and body. Like even in Ayurveda also, when students come for the first year and when they start learning about the Atma, Man and all these things, they are saying that what is this? What we are learning here? We are becoming doctor, or we are becoming like some like what you said, that Santa Mahatma, like that, they are saying like that. So the thing is that the students are not really like these kinds of course. But yes, as Dr. Kala said rightly, that counseling is the main thing. That we are also doing the same thing, counseling to the students, telling them this kind of courses are very fruitful in the future. Like that. And in technology side, we are keeping these courses on credit base. If you are doing these courses, then you will get the credits like 2 credits, 4 credits, like that. But in health sciences, there is no credit courses. So sometimes we are doing counseling, sometimes we are doing compulsory courses, or sometimes we are now adding this minor degree course in the university level. So in that way, we are introducing these courses. Even we are having this IPDC also, internal. Uh, this course is also meant for the students' development only. So this kind of courses we are introducing on university level. Thank you, sir.
Thank you so much. And I hear you, and I think it's really important. I mean, at one level, while it's good to start early, we need to continuously focus on. Sorry, do you hear me well? Yeah. So I'm saying that it's important that we build evidence for it, and also not people don't need to accept this just because somebody is saying so. They need to really evaluate it at their own level, observe it, and then be able to, analyze and understand and evaluate and then accept it, rather than just that this is how it is. So, I mean, when somebody says Atma, I mean, it's it's not always easy. And it's good for students to question us as to why do you say there is an Atma? Okay. Why do you say there is a self in a body? But then we need to really further dive deep into it for them to get a sense that there is something beyond the body which is trying to guide the body. So and I think with that kind of exchange and good, meaningful, curious questioning and answers, they will then develop a liking. And my broader sense tells me that at times they might develop much greater interest in such course, and because this is what is enabling them, preparing them for life much beyond what your courses or clinical courses will teach them. So the impact of universal health values is in terms of preparing the individual not only for the profession that he's doing, but also as a very responsible um, person in a society. And so it's more in terms of being in harmony with himself, and then being harmony with the family and society. So I'm sure that they should find it useful as they become more understand the whole thing and are able to accept it, not because somebody is saying so, but they themselves analyze and see it within themselves, and evaluate and find that this is indeed how things are. Okay, let's move on then, and I'll now request Dr. Satyanarayan. So you really invested a lot. So wish to hear from you the challenges you faced and how you plan to overcome them and how do you plan to advance in future. Yeah, over to you, Dr. Satyanarayan.
Yes, sir. Yes, sir. Thank you. And as we also face some challenges because when any new thing, new ideas are introduced, naturally we face some challenges. First challenge was, the skepticism from the faculties. So that reluctance, certain sort of reluctance to use the, I mean, to attend these such programs, allow these programs. So what we done was we chose small groups of faculties, around 10-15 members. Then we conducted sensitization programs on universal human values. So slowly they felt something that something is there. We should do something for that. So that was created. Second step, we introduced the students. But the again second challenge was the curriculum that the NMC National Medical Commission curriculum is very tight for medical students. We couldn't fit somewhere, because all routinely they'll be doing all the duties, clinical teaching, do everything. So what we planned was wherever there was time, some time we introduced that universal human values course there, some 2 days, 3 days, something like that, fit in there. And once that was done, and the faculties were little bit, they get the feedback from the students that it is very useful and it is find the meaning of life or purpose of life like that. So introduced UHV course to first MBBS students as a part of their foundation course. When they come from school to college first year, when they come in, we started this course 7 days to 2 hours per day, 15 hours as a validated course. The course was very much welcomed by the students. And it was very much the stress levels were very much reduced in the campus for the particular batch. So based on the results and feedback, we introduced UHE2 also to second MBBS students as part of their foundation course, as requested by the administration and the vice principal. We introduced them for second year also. So we create a climate where these values can be felt there everywhere. So third third challenge was the sustaining the interest of the students. So what we done was once we done the course, then we have gone. Then again routine has developed. The routine clinical postings like that will be there. So for that we started a buddy club, UHE buddy club, where students can interact with each other and interact with the mentors, so that it will be reinforced again and again such value related things. And fourth challenge was mm, the resources actually. So initially we have only 5 persons were there. We just bare hands with only VHE in our mind, and we were there 5 people, and one is Dr. Mirnalini. She's there panel, and we started with that. But what we done was the central team has got website, AICT, UHG website, FDP. There we identified all the resources. Everything is ready-made, structured. The whole presentations are there, PDF format is there, videos are there. So we utilize all those things in a short time. We introduce all these courses one by one. So it will be very much supportive from that side. So that challenge also tackled. So like that, we followed three things. One is persistence. Second is patience. Third is lead by example. All these three helped us. And of course, for new institutions, when they start, we advise such order can be followed. First, since the faculties, let them have some interest in values. Then slowly you can introduce to structured courses to students. Then third step, we can go for holistic health related courses. Then we can start a holistic center of well-being. I feel my experience based on that, I think in that order, I'll suggest to start. So it will be very fruitful because felt the value of these such courses, because students are coming, they follow the same curriculum, same pattern, everything. Routinely they are modeled into fit into the routine mainstream medicine. But this holistic approach is never been done anywhere. So I feel this is a way we should proceed further, because our world is in crisis now because lack of the supports, the costs are increasing, healthcare costs are increasing, and the health system is unsustainable, and lot of problems are increasing, and in such a situation.
Yeah, thank you so much. No, you're so right. I mean, even the richest country in the world, they spend 17% of their GDP,
Yeah.
and then also they're struggling to improve the health or contain the costs.
Yeah.
And there's still people getting impoverished or facing catastrophic healthcare spending.
Yes.
So, yes, but I heard you persistence, patience, and leading by example, and then sequencing in terms of starting with faculty, smaller group of faculty, and then structured courses for students, and then moving on to holistic human health, and then moving further towards centers of well-being. Thank you, Dr. Satyanarayan. And now over to Dr. Sudipta.
Yes, sir. Yeah, we think that there is the implementing of the holistic health is a really difficult for the small institutions. Rather, the government, I mean the regulatory body, they are giving the compulsory and the mandate this. As because the students, they're facing the lots of challenges, even our the college, the bodies also, the limited resource, that the lack of teacher training, there is a lack of flexibility about it. So if it is, I mean, the students, they are always thinking about their credit point. I mean, the syllabus. So in the last time I told that the implementation of the proper structure of the UHV from the very beginning and the prior stage, it can help the total system for the restructuring, and the value added education is the immense value, not only for the education, but for the correction of the society for a meaningful purpose of the life. That is the main motto. That should be the main motto of our human being and the human being society. Unless this, whatever we do, that is only for the clearing their examination purposes or like this. They are not thinking about the value, the need of the value educations in their life. If they don't know about it, the UHV, then how can we expect that doctors or the big, I mean, the big professionals, one day they will be the, the game changer for the society. So this is the main thing. And problem is there are lots of problem as because this is a holistic. So whenever we establish a new thing, there is a problem. The problem should be there, but it is the continuous process, and hope definitely we will overcome after the regulatory body implementing all those things from the very prior stage. Thank you. Thank you, sir.
Thank you so much. I hear you, Dr. Sudipta. It is true that if the regulators were to introduce such courses in the curriculum, that would obviously make things very, very easy, and then it will scale it up. The critical thing is that we need to create enough body of evidence for the regulators to be able to accept this. Okay. So I think each of us could start small within the resources, within the constraints that we have, and establish and build an evidence. And then based on that evidence, we would be able to create, we will be able to open the door and create a window of opportunity, and then introduce it with the regulators, just as one managed to do it with the AICTE. So it's been easier to introduce this on the engineering side, but we have not been able to do so with the regulators on the medical side. It's certainly more challenging on the medical side. Okay, thank you so much. And we have about still about 15-20 minutes. And now for, this is more in terms of your own commitment and your willingness to participate in the, we heard the holistic wellness clinics, where about availability of specialists from various streams, and also about having these health educational workshops as an add-on in the current systems in your institution. So the objective being that the institutions evolve into holistic centers of health and well-being. And so just wanted to get your sense in terms of how willing and prepared you are to introduce this in your institutions, you know. So again, we'll have a quick round, beginning with Dr. Kala and then Dr. Meenakshi. And so over to you, Dr. Kala.
Yes, sir. So questions, sir, once again, sir.
Sorry, no. So we just now, it's more like your personal comment. So the possibility and your willingness to participate regarding helping develop your institution as a holistic center for well-being, and whether, you know, in terms of you be in a position to participate in developing holistic wellness clinics, etc., as an add-on to the current systems in your institution.
Yes, sir. Yes, sir. Thank you. Yeah. I do have such an idea to start such a kind of holistic clinic in our institutions. So how to involve with others, that is the important one. So it's not a job for the single person. So we have to involve multiple personalities, multiple disciplined people to involve, to integrate all kind of, like start from the Ayush, the homeopathy treatment, everything together to start a holistic human clinic. So it definitely it will be beneficial not only to the individual and also patients and the community. So I do have some kind of idea to start the holistic human health clinic. So it's a separate clinic here. We are not going to talk about what is the disease, what is the expenditure, what kind of thing, not so. So we can explain them. So how to improve yourself, start from the yoga therapy and daily morning practice and digital free time, then writing the morning diaries. So if you teach them without speaking the medicine, definitely the people will get the kind of attraction. So nowadays the people are hesitating to go to the hospital, to consider the economic burden. So if you talk about the regular thing, investigation, drugs, treatment, definitely they will have some kind of bad opinion on that. So in spite of just skipping that side, that is one part of the thing, treating the patient. The other point is the holistic way. So we have to encourage them to have the yoga therapy and everything, mind health, considering the mind health, everything. If we teach them, definitely will have that. So we have to keep on separating along with other regular OPDs. So we can encourage them, the patients attending the holistic clinic. I think initially it will be a struggle only, but slowly we'll get the thing in the scenario. Yes, sir.
Thank you, Professor Kala. Over to you, Dr. Manjari. Dr. Meenakshi. Yeah.
Yes, sir. So the holistic clinic is the best idea, but here I should add something in that. In this, we will do the assessment for, like, student assessment, if it is a student or if it is a patient, whatever it is, because we are not discussing about the disease here. We are discussing here the personality and all these things. So we will do personal assessment, that his physical wellness, mental wellness, financial wellness, everything. So according to that, we will give them some, we can say it as a SMART goal, what we literally call nowadays SMART, that specific, measurable and achievable, relevant and time-bound goals. So if it is a student, the nowadays this just say that discipline about the digital use or gadget use. So just give the student that, yeah, you can, we cannot stop them by using these gadgets, but we can give them that, yeah, you can use it for 1 or 2 hours, then stop it, like time bound or specific measures. Otherwise, if it is sleep, then 7 to 8 hours sleep is must. So like that, we will give some small assessments to them, improve in themselves. Then again, we will give them the support system also, because these we faculties are the support system, and their parents are also the support system for this generation now. Gen Z don't want to judge them. They want just listen to them, because nobody is listening to them. So just listen whatever they are saying, but don't judge them. So according to that, we can say that we can continue these holistic clinics by just listening to them, and then we can afterwards we can give them some suggestions like for the mental wellness, yoga and meditation. For health, nutrition, not the calorie-based diet, but nutrition-based diet, we can give them. So, even the financial status also, we can give some financial advice with some experts. So, like that, we can continue these clinics. Thank you, sir.
Thank you so much. Yeah, it's important to have the clarity, yes, and it has to be done in a multiple ways. We have over to you then, Dr. Satyanarayan.
Yes, sir. So personally, I am totally committed, and because I am transformed through this, I can see the vision and the implementation part of the holistic health program. So I got a good team. So together we will be implementing this, step by step. So first step, groundwork you have done, introduce structured courses to students, and introducing future courses to which I already told, holistic human health course that we have done. Next step, final step will be the starting a holistic center of well-being, which is our dream about the holistic human health, because a center where it will not totally replace the modern medicine care, but it will add a support to the modern medicine system, because modern medicine focuses mainly medicine and treatment part. Our center will be focusing on the other three, intake, routine, and posture, as well as the exercises like the labor, like that. So, and also we support not only physical care, but also the mental, emotional, psychological, as well as social and well-being, all the levels of well-beings. Spiritual support can be done with various approaches. We would like to plan into a phased manner. First phase, a small setup where, initially with low cost setup, we can do some help like awareness campaigns, or involving students in educating about holistic healthcare. Slowly, phase 2 will be planning again. Complete courses should be available to all the students. Then third phase will be doing research on holistic human health, as well as we can involve counseling to faculties and staff members. And fourth phase, it will be open to public, where everyone can approach the center, where they can get counseled, as well as they can get educated ideas about the holistic human health. So this way we are planning to implement, but definitely it's a vision of our team. We will be looking into that always. Thank you, sir.
Well, thank you so much, Dr. Satyanarayan. Good to hear that. My only request would be to undertake a structured research design and then implement it, so that we build the body of evidence needed to advance this work.
Yes.
Okay, then I'll move to.
If I may interject, Dr.
Yeah, please,
Jalani.
please, Dr. Sharmila. Yes, I'll be very happy. Yeah, please come in.
I think Dr. Swaroop Kumar Panda has joined, but his video is not on. I see him in the people in the webinar. Dr. Panda,
Yes.
if you can
Yes, ma'am, I
unmute
have
and
done.
speak. Yes, you can turn on your video also, so that we can see you.
Sure, sure. Okay, ma'am, I'm there.
Yes. Sorry, Stu.
Very-
Dr. Jalani, Mr. Jalani, he is a medical biochemist, and he's also interested in holistic health. So you can involve him also in the discussion from now.
Thank you, ma'am, for the introduction.
Yeah, thank you. Thank you so much, Dr. Panda. My apologies, we missed you for the initial part. So just as we were discussing, it's a very informal kind of session. So I would pose some of the questions which I had posed to the panelists earlier. in
Sir.
terms of, Dr. Sharmila had, at the beginning of this session today, had presented not only the vision for health, but also in terms of implementing this holistic vision for health, in terms of the resources that are available to be able to implement this vision for health. So just wanted to get your sense, it's in terms of, as a healthcare professional, what do you see this the possibility of implementing this holistic vision of health in your institution,
Sir.
in addition to what you're already doing? Over to you, Dr. Panda.
Sir, definitely, sir, we can do this. And SOA University that I am belonging is continuously attending this thing only, sir. Holistic health education to all medicals and along with paramedicals also. Sir, we are all integrating all this depending on the CBME curriculum advised by the NMC board today from this year onwards, CBME curriculum, competency-based medical education. As well as, sir, SOA University is planning to all implement everything, sir. Total holistic development of all medical students. So it is very easy to implement this holistic health education in our university. As far as my concern is, my part is concerned. Thank you, sir.
So how did you manage to convince the college administration, the university administration, and the NMC in terms of being able to introduce these courses?
Sir, it's because the students are also quite enthusiastic to implement this holistic health development, for as well as they want to their physical as well as mental and well-being, and also progress. Not only for the in career, in their own academic career, they also want to implement the holistic development in your mental and physical health also, sir. A cumulative approach is there in this university, sir. So it is very easy to implement this thing.
So you didn't have any difficulty in terms of convincing
No, sir.
university?
At present, our Dean Madam is so much enthusiastic regarding this NMC guideline for implementing holistic health education for the medicals. So it is very easier, and I am happy to share this thing. At present only, we are also implementing this holistic health education to all the medicals, sir.
Wonderful,
And,
wonderful. So
we
nice
are
to hear
considering
that.
also the yoga, pranayam, and all. The World Yoga Day in 21st June is widely celebrated last year and this year also, sir.
Okay.
Because students are paying attention for this thing. That is the main plus point for us, sir.
Yeah. Yeah, I mean, we presume that this is indeed very beneficial for each and every individual. And once the students start experiencing the benefits and start demanding it, it will become more popular, and it will also become easier to mainstream this as part of a curriculum across the country.
Sir.
Okay, thank you, Dr. Swaroop. And we were also, you can continue in terms of what your future plans are in terms of trying to develop the institution as a holistic center for health and well-being. So, what are the future plans? And
sir, from the grassroots level, we are trying to implement this holistic health education, sir. Starting from the primary education, primary, secondary, and then our graduation, then post-graduation. Every level, it will be integrating into this holistic health approach, sir. Because from the grassroots level, if we are implementing, then it is very easier to carry forward this. Right, sir?
So are you also responsible for secondary education or primary education?
Sir, as far as the country is concerned, these things should be implemented, sir, from the grassroots level only. From the earlier days, if it is implemented, then it is very much easier to carry forward in future careers. That is my point.
Okay, yeah, no, I entirely agree that the sooner we start it, the better it is. This is good for the individuals, for the students, also
Yes,
good for their parents and the institution. So I just request comments from we discussed we were to hear Dr. Sudipta also, and then I'll just request any 1 minute, 2 minute comments from each of you. So first I'll take Dr. Sudipta in terms of the possibility and willingness to and commitment for the holistic wellness clinics. And then we'll just have a round, final round for just 1 or 2 minutes each, final comments from each of you.
Yes,
Okay,
sir.
Dr. Sudipta,
Yes.
over to you. Yeah.
Sir, it's definitely we will start the wellness clinic, the holistic wellness clinic, and this is a very good approach for the positive thoughts and integrating wellness into the core curriculum. And we must involve the parent also. And if we can do this in such a way, this is a team, the college authority, the parents and the students, the fruitfulness is only come out. That is the support from the every level. Otherwise, it's we can't achieve it. And engaging their mindfulness and the physical education, the drilling, the social activity, and different ongoing professional development. That ongoing professional development can build the perfect human being, the supportive cultures, and properly communicate them, and the easy way to counseling all the students. If the students getting the benefited from this, the repeated and radical cultures about it, then only the fruitfulnesses come out. The yoga, meditation, the music therapy, this is a proper integrating the holistic nature. Yes.
Thank you so much. Thank you so much, Dr.
Jalani
Sudipta.
ji,
Yeah,
maybe we can go to the audience now.
oh yeah. I mean, I didn't know there's a mechanism to take questions, or you have to read from the chat.
Yeah, Amipara ji can mention from the chat.
Oh, wonderful.
Or any hands raised, Amipara ji? Could you help with that?
There is no question on a chat. I would request the delegates, if anybody would like to ask anything to any of the panelists, they can raise your hand and we can provide a mic.
Sir? Good evening, sir.
Yes, Dr. Mirunalini.
It's very nice to hear from you, sir. And thank you for joining us today. Yeah, I know my voice is echoing. Good.
I think if others can mute their mics, the echo may not be there.
Yeah, I think now it's fine, sir. So thank you so much for joining us today. And it was very nice to have you here with us and to hear from you. And like I have been exploring this UHP proposals here when I attended these faculty development programs in our institution, SRM institution in Chennai. So you were saying about the need for compassion in healthcare professionals and how it should be something that the person sees from within. So I just thought that it would be right time that I share my personal experience, how I went through this transformation. So what I saw in myself is that, even though I am an ethical person and a naturally compassionate person, but when we do the practice, the daily practice, it was not sustainable. So there were many factors that hindered, and sometimes we just get irritated with the patients and attenders. I'm sorry to say that, but it does happen. But then I started this process of self-inquiry, and what I saw is that this behavior from me, it did stem from my notion about two aspects, the notion about happiness and the notion about respect. So what I saw is that my notion of happiness was that when somebody praises me, I become happy. When patients say that you're a good doctor, I become happy. And about respect also, when my colleagues or senior professionals or the management, they give an increment to me, or they say that you have done a good job, and when my students or my junior colleagues, they stand up, salute me, I was under the notion that that was respect. But then I started exploring this process of self inquiry, and what I found that is happiness is something that is innate in us. So, and respect is what I have on me. It is not something that I can derive from outside. And even with practical experiential validation, I saw that when the transformation happened within me, like previously, I was working and expected happiness to occur from outside. But now I became happy within me and then I started working. So that started spreading to everyone. Even patients were able to see the change. My colleagues, my students, everybody was able to see the change and they were able to relate very well. And then they started asking me, like, you were 2 years back, you were so like that. And how did you change like this? You have gone into a Zen mode, you have become quiet, but still your work efficiency is so good. And all these things, it started to practically happen. And regarding the compassion, I would say the proposal on trust. So it's a two-way thing. The patients need to have trust. And this I can say from the conclusions of the panel discussions we had over the past 2 days. When we asked this question about concerns regarding lack of compassion in healthcare professionals, the answers from panelists were like the doctors are overworked and patients also don't trust the doctors, and that is why doctors get irritated. We are not able to spend time for the patients and all these things. But what I feel is trust is something that every person, it's not just the doctor or patient, it's up to the individual that we have on everyone else. And I have seen practically this notions of happiness, respect, and trust. They're all something that stems from within each one of us. So, what our education does today is we have many different models, and they all put on proposals. But what I practically see is that they all act at the level of behavior. So we can teach people to be compassionate, to respect others, to trust others, but they are all at the level of behavior. Unless one sees and experiences these feelings from within each one of us, then I don't think the transformation happens. It might happen at the level of behavior, but the behavior is dictated by the thought an individual has, and that thought is again dictated by the feelings from within them, and that feelings they stem from the understanding the person has on the reality. So this understanding will come only on self-inquiry. So here I would just really state the importance of education. So now in medical education, we have so much about the body, the physical ailments, and so on. But there is no curriculum that teaches interpersonal relationship, self-satisfaction, about the purpose of life, the notion. We get so much books on what to do and how to do, but there's no syllabus for why we should be doing this. What is the actual value and purpose behind all these things? So I feel that it is right time that such courses are introduced in education and that we get support from higher ups to introduce these courses. So here in SRM, our management is very supportive and we have been implementing these courses even for medical education as value-added courses for the past 3 years. And the results with students and even faculties, it's just amazing. So if it can be made as a regular course, that would be really very nice, sir. So that's it I had to share, and thank you for your time, sir.
Thank you so much, Mrinalini. And I heard you loud and clear that genuine happiness or genuine respect, etc., does not come from without, does not come from outside, but comes from within. And also the need for including in the curriculum the purpose of life. My simple my one query or request would be that the change that you witnessed within yourself through self-inquiry, is there a way to bring this to scale in terms of where you don't, one is not looking for happiness or respect from outside, but it should happen from within? And how do you, instead of one transformed Mrinalini, can we have hundreds and thousands of transformed people? And what is the science behind it? And how does that happen? So that's a challenge before us, which we all need to attempt. And but good to hear your personal experience. Are there any more reflections or comments? We are almost about time, and if there are no further comments, I just need to, as per Dr. Shamil, I have to provide my concluding remarks.
I think you can go ahead, Jalani ji.
Okay, thank you so much. So basically, we heard we've heard from our panelists various efforts being made across institutions and an overall positive impact. I mean, I did mention to you about the concerns and the discussions we have so there are big concerns within WHO around 3-4 areas. One is around the growing lifestyle disorders. Okay. And everyone globally recognizes that treating these conditions, one, it's challenging. I mean, it's not easy to treat these conditions. And two, whatever medications we provide, they're highly unsustainable. The other challenge we face is in terms of the issue around trust deficit, issues around lack of compassion, and also, I mean, in some sense around the clinical competence. We face challenges in terms of doctors not wanting to serve in remote areas, doctors not always being polite and courteous, and then there is a whole gamut around corruptions and commissions, etc. So here, what I heard from what Sharmila ji was presenting is that there is a potential to address all of these in a very holistic manner. Now, what we need to be doing it is in terms of creating and establishing more robust evidence around it, in terms of the why, what, and how. And that can then help in terms of really scaling it up. But this topic, this session was focused on the youth, and what we also heard from almost every panelist was started early. So in a way, all of those who are participating in this panel, particularly the young people who are participating in the panel, it's good that you are exposed to this sooner than later, and so that you are able to lead a more healthier and a happier and a more purposeful life. What we also are seeing is that, and this is not true just for this work, we see it across that you need, and what our great father of the nation, Mahatma Gandhi, said that few committed individuals can alter the course of history. This is what Mahatma Gandhi said, and I strongly believe that few committed individuals who are driven by the conviction in their mission can really make a huge impact. And what we've seen is that small group of people starting and then this really picking on. What I noticed from here is that currently, from Shamila ji has mentioned that about 750 plus volunteers are working on this effort to bringing human values in higher education. They're all working on a pro bono basis without any honorarium or incentive because they're convinced about their mission. They see the value in what they're trying about a better, happier, and a more peaceful world. I think we hear echo. I think, yeah, okay. Lastly, I mean, this holistic health is one. I mean, so you have the universal human values as the foundation, and built on the universal health values is the holistic human health. I'm sorry, there's some problem. Yeah. So what we heard also from Mrinalini towards the end is the criticality of importance of self-inquiry. I think that's individually and at my own personal level, I have been trying to do that. Whenever this idea was introduced, I keep on saying that uh, what is it that you want to seek from life? What is it that would really bring you genuine happiness? And trying to see our interactions, interpersonal reactions, etc. I also see as to why we still undertake things that we know are not good. So I mean, whether it is people put it in terms of dopamine and all that, I know eating certain things is unhealthy, and that understanding I have, and yet I also eat things which I shouldn't be consuming. Because they're not good for your health. So there are those issues as well, that while at some level we realize the value, I mean the human values and their importance, it needs to really get internalized the way Dr. Mrinalini was saying. And how do we do that is another challenge. I think what we notice is the work that's already spread. It's being done on a fairly large scale, very large scale in terms of area of universal health rather than education, particularly in the technical area. The work around holistic health is sorry, the work around holistic health is still not has not expanded as much. It has made good progress, but I think we could do much more on that front. So with those broad comments, and then again, I was just looking at the initial things around looking at human being as a coexistence of self and belief, the triple H, healthy self, healthy body, healthy environment, holistic human health, and trying to a systematic way of implementing the vision of holistic human health and the resources that are already available. I think if we make use of all of them, we will be able to accelerate the implementation of this vision. And with that, I hand it over back to our person introducing it, and to Sharmila ji. Over to you. Dr. Amipara.
Yeah, thank you very much. On behalf of ICVC 2025, I thank all the panelists, UHV point of view, delegates, and other all participants. Also, I thank you, tech team, organizing team, our sponsor partners, and other who has supported directly or indirectly. Thank you very much. We will break for the next session. Thank you.
Thank you all. Happy New Year.
Thank you.
Happy and prosperous New
Merci.
Year.